Hey, good morning, 737. Let's head into the Zoom room where Dr. Pete Lombard is standing by. He's been crunching COVID stats since way back when the show was called Containing COVID. It's the link now at 737, Tuesday, November 24th, Thanksgiving week. Dr. Lombard, good morning.
Good morning. How you guys doing today?
Well, we're ecstatic that our car score is down to 9.0.
Yeah, it's a big jump, huh? We're getting closer to that 5.
Good job, Guam. We just congratulated the audience and everybody out here. It looks like we're doing what we need to do. Doc,
Yeah, things.
does it make sense to you? I got to ask this first off. That
Well, as you know, as we discussed the last time I was on, it's a single metric. For a lot of people, it's not enough. They'll need and want to see other metrics as well, just to kind of gauge where we are. But I think it does make sense in the context of the things that go into it. They're looking at your number of cases per day over a 1-week average, your positivity rate, and that elusive RT value, and all of those things are going down. So it definitely makes sense that the CAR score is going down as well.
But does it make sense?
are we better
Um,
off?
Yeah.
Are we better off than we were? Like, let's say a week ago, it was 41.5.
Oh, there's no question. There's no question in my mind. We're much better off. And I'll run through some slides and some graphs today. And I think that that's the problem with the CAR score, is that it doesn't talk. It doesn't look at enough detail for, I think, a lot of people to really understand why it's better. So, but I certainly think that it's a reflection of what's actually happening out there, that things are improving. I mean, it's not at the level where there's no all clear, but there are definitely indicators and signs that things are improving. The
Tell
CAR
us.
score would not go down unless unless the picture was improving outside.
Right. So, in what way are we improving?
Well, we're down almost 50% from our peak hospitalizations, and that actually doesn't go into the CAR score.
That's what
But
I'm saying. So when we're
we
looking at it, the biggest difference we see is the hospitalizations from 70 to 48, 18 ICU, 8 total ICU. But you're right, that's not part
our
of the
peak,
the car score.
yeah, we were averaging in the upper 90s, even on average over a week, we were averaging over close to 100 cases a day. That number has dropped down to close to 50. So a 50% decrease in the average number of cases per day over a week is tremendous. Our test positivity rate has decreased from, it was getting close to 20%. A few days it was over 20%. And now that's looking like it's coming down to 10% or less, which is almost a 50% decrease. The RT value, which is it measures how much spread is happening in the community, that is decreasing as well. It's certainly, I would say, below 1 at this point, and that's a big improvement over where it was a couple weeks ago as well.
What can you glean from the RT and exactly what it means, maybe in layman's terms?
Well, it's a number that we like to see below 1. If you're at 1, you're going to have a steady state in terms of the number of new cases, a plateau. If it's below 1, then those number of new cases per day should start to decrease. If it's over 1, they are going to increase per day. So I think before the construction cluster, we were seeing a plateau that was starting, and then we had that spike, and the worry was that was going to spread into the community and affect our older age groups. Then that would translate to more hospitalizations and deaths. But the good news is that the signs so far don't appear to show that.
Could you go into what and how they figure out the RT? Is contact tracing part of that?
It's actually a much more complex calculation, and to be quite honest, I don't think I could do it justice. And I don't think I could adequately explain in a way that would make sense to everybody how it's arrived at. It's an epidemiological number, and for COVID, initially they were worried that the RT and uncontrolled spread, no measures at all, would be 2, 3, or even 4 in some of the early estimates of RT. That's with zero control measures, and with adequate control measures, you can certainly get that down 1 and below 1. Anytime we've had an improvement in the number of cases we've had, it's because overall, all of the control measures that we've had in place have been able to decrease the spread where the RT number goes below 1. And it's just one of the 3 numbers that goes into the CAR score. And I really don't know that we need to, get too wrapped up around the axle about the CAR score. It's just, again, it's just one more number that we can use. If you want to use it, when you see that get to 5, you're going to be feeling better about the situation, but you're also still going to want to look at our daily cases over an average week. You want to see what our test positivity rate. You still want to be looking at your hospitalizations and deaths, of course. I see a lot of hand wringing over the CAR score, and it's one more thing. Maybe that's more complicated to more people. Well, you can ignore it if you don't want to, and just keep looking at the numbers that you're used to.
I think why we're hand wringing about it is because they've held it up as the new gold standard and said that if we get it to a certain level, then the governor will lift the social gathering restrictions. That's what we were told yesterday. So. I feel like
it's an incentive.
That's the metric they're using. They're not using any of the other numbers. They're strictly applying the CAR score to and tying it into, what was it they said? If we show the governor how responsible we are, there will be positive reinforcement and a reward. They're not saying that about the number of positives, the test positivity rate, the deaths, the hospitalizations. They're saying that if we get this singular number that they came up with this formula for, down to 5, then set my people free. Merry Christmas. You know what I mean? So that's, I think, the reason why there's such a huge focus on it is because it was trotted out as the new thing.
Well, I'm sure you understand the goal is to try to make things simple. And if they decided to point to any single metric, let's say they said, hey, let's just look at cases per day. And if they said, okay, Guam, our goal is less than 30 cases per day, then you get people coming out of the woodwork saying, well, that's not the only measure that's important. You've got to also look at all these other things that are important that describe how the virus is doing out there. If you said, well, let's just look at deaths, let's just look at hospitalizations. If they picked any one of those things, there's going to be critics about using that as the sole metric to define whether or not we open things up. So this was an attempt to pull in multiple different factors so that at least those types of criticisms can apply. It does bring in all of these things. And I'd argue you could say if we had 30 cases per day on average over a week, not in a single day, because as you saw, we had a single day where we were close to 30 already. But if it was an average of 30 cases per day over the course of the week, that actually, it follows along very closely with a CAR score of 5 if you get down to that level. So they could have said something like that, but it would invite criticism that it's not paying attention to some of the other metrics. So again, I think there's utility in it. If you understand where it's coming from and use it in the context of you can sort of compare it in the context of the other metrics that I think are a little bit more easy to understand. Even test positivity rate. I think you could say if our test positivity rate goes below, say 6 or 7%, we'd like to see even lower, but 3%. If it gets down to that level, then that corresponds with a CAR score of around 5%. And so again, you don't want to necessarily just rely on one metric. And at least when you say there's a CAR score and it reaches a certain number, it has taken into account a number of different metrics that I think you could be more reassured that they're all being considered in that CAR score. And I don't know how else you could do it with a single metric. I mean, you could pick any single metric and it's not going to be a complete picture.
Right. No, I just, when it comes to the whole CAR score, and just to see how a week ago it was 41, and then a week later it's 9. And in between that time, you saw over 400 additional cases of COVID-19, whether it was a cluster or not. It's just concerning to me that we're going to be like, hey, everybody, right before Thanksgiving.
Hey, I'll say this before, I can get into the CDC, how they do that in a second here too, if we can pop up the slides. But just, I would say on the CAR score, what's not quite ideal about it is that I think in the lower levels, like between 5 and 15. There's a big range of what the other criteria can look like. But when things are out of control, it rapidly goes up very, very high. So, it's encouraging that it's come down, but I think the way that it's scaled, because of the way it's calculated, it makes it seem like these giant jumps in the CAR score are better than they actually are if you try to look at the same changes in the criteria that make it up. So that would be, I think, a reasonable criticism of the CAR score, because it did jump a huge amount, and that's hard to wrap your head around. How could it change by that much when there hasn't seemed to be as much of a change in the other metrics? So I'd say that's definitely a valid criticism.
Yeah, and you couple that with general mistrust of the government in general, right?
Yep.
That's ripe for critique. So let's get into the CDC. I guess they didn't get the memo about our CAR score because they jacked us up. We're
Are
going
you
to share
guys
screen.
able to
Are we,
pull
Jay?
up my slides?
Yeah,
Of
Jason's
course,
pulling it up.
Dr. Lombard always
Okay.
got to come with a slide, so we're going to enable a screen share. And what you're going to be looking at here are some of the charts that Dr. Lombard has done for us. So here we are.
All right. So, again, we're showing this is the peak over in started in August, hospitalizations followed by a couple weeks. This was the peak back in the end of October. Hospitalizations peaked a couple weeks later. This peak in cases was from the construction, and thankfully, the hospitalizations continue to go down. And I think that's just because it was as hoped, much more segregated within that community, and it didn't, to a significant degree, affect the community and the types of ages and susceptible populations which would be admitted. Now, I still feel like we have to wait a little bit longer to say we're in the clear from that construction spike, but you can see it was a huge spike on your 7-day case average, which is in blue there. The test positivities in the dotted purple line, and you can see it starting to take a nosedive. And so these numbers way out here, we're about 50 hospitalizations and 50 new cases per day on a weekly average, which is again about 50% of where we were at the peak numbers. How is Guam doing again, and compared to the rest of the world, or the rest of the U.S.? As you can see, we used to be, one of the worst. We did a little bit better. We got worse again, but look at the rapid upswing of all the U.S. states. They've all sort of rapidly surpassed us in Guam because of the last week or so. It's taken, has really come down, and we're looking a lot better. And this dry tinder effect is the states that haven't had a significant, surge in the past. Those are the ones that are feeling it now, and to a very, a really worrisome degree. I think if it doesn't take much. If you follow the news, you'll see, hospitals, they're where we were, a month ago, where they're completely maxed out. They're having to convert normal rooms into COVID rooms. They're having to set up tents. So a lot of other states and cities are starting to see that pain that we went through a month ago or two. This is interesting. I wanted to see, how we compared. When you look at all of the deaths that we've had, and you say, for our population, how many deaths do we have for our population? And we're way down here at the bottom, number 23. We're close to about 600 deaths per million, and that corresponds to about 100 deaths for our 166,000 population. But we're number 23 in the world, so it's up there certainly. And there's really no other small island nations that are there. And if I actually went through and actually just pulled out a bunch of island nations, and you can see we're near the top. So I think it's and by quite a lot. I mean, I think we're easily double, sometimes triple a lot of island nations, and there's a huge grouping of them down here. So I think this points to the fact that you should have a leg up if you're an island nation. And for us to not have had as good control of some of the other island nations in the world, I think that says a lot. But I thought that was interesting to see, and we can talk about the reasons for it. But I wanted to jump into the CDC criteria because we're at this. I had to go up and look this up to see how they actually calculated. We're at level 4, very high, and this is for populations of 200,000 or less. They have a separate criteria if you're over 200,000 population, in which they take your case count over the past 20 days and they normalize it for the population. For if you're less than 200,000, they just say, what's your total number of cases over the past 28 days? And they say if you're over 100 cases in a month, that's level 4 very high. That's like 2 to 3 cases a day. So we haven't been at that level, and not only that, but you need to sustain it for 28 days. So we haven't been, this is the green line here, we haven't been at that level since July 1st is when we sort of crossed that threshold of 100 cases in 28 days. And we almost went back down underneath that line in towards the end of July, early August, but then we rapidly obviously see we're nowhere close to it. And so, I think according to their own criteria, we should have been called level 4 since July. Okay, so I think I don't know why it became much more of an issue now, but it's the criteria is extremely strict for level 4, and in fact, almost every country in the world is level 4 right now. I think I've got a world map. They have even secondary criteria, which we can skip over because it's not even relevant. Here's on the CDC website. This is the world map of their COVID risk assessment scores for travel. The United States is level 4. Almost every country in the world is 4, except for the countries that we know are doing a good job. So again, a little bit of hand wringing over this level 4 CDC threat level, but it's been that way for a long time for Guam, and it's the same way for almost every other country, including the U.S. What they don't do for the U.S. is they don't apply the same criteria on a state level. This is primarily designed to help guide people when they're thinking about traveling. So getting down to even level 3 would require us to get down to the number of cases per day in that, I think, 2 to 3 range. I don't want to, belabor this point. I also don't think that we need to sensationalize it. It is what it is in terms of how they calculate the very high level 4 COVID risk score, and it's going to take us a long time before we get down to levels where we can be considered level 3. Right. Does that make sense?
Yeah. So.
Yeah, and this level 4, they just implemented it Saturday when we were designated as level 4. So this new criteria so came out on Saturday.
Yeah, maybe this is brand new stuff, and I thought I saw they had some sort of risk criteria before, but maybe they're just trying to make it more formalized and push it out. I'm not sure what.
Yeah, well, they just added level 4 on Saturday. So
they never used to have it before.
Yeah, it's new, and that's why I was like, well, we're level 4.
We were
same
level,
day. Yeah, the same day that they implemented this new criteria and established level 4, we were designated as level 4, and don't go to Guam.
Huh. Well, they also, I guess, made the same designation for almost most of the world. So I'm not. Don't travel is bottom line. Don't travel.
Unless you're going to Saipan, Doc. I gotta say, unless you're going to Saipan.
Yeah,
Saipan is green. I saw a graph yesterday, and it was like Saipan was like the only green place.
Yeah. So again, here's the CAR score. I think you can look at test positivity rate. If we can get, we were in this rate when we were around here 7%, we were actually within a CAR score of 5. So again, you look at that 7% test positivity rate would be a good goal, and I think that's going to correlate.
Easy guys, I'm still there.
There you go.
Okay, sorry. Same for our daily new cases. This is when we were below 5 on the CAR score. Our average cases per day were in that 30 range. So if you wanted to, you can look at those numbers, and I think maybe it'll give you a little bit more understanding. And I didn't update. This is what Dr. Cabrera gave us on November 12th. But our CAR score has now plummeted down to in this level here now. So not where he wants us to be just yet, but I think all the indicators are looking good. Here's that age breakdown that I like to do, and again, you can see that massive jump in the green in the 40s, almost 2 to 3 times more with the construction and DOC clusters, and that still is elevated as of the end of last week. And I'll be able to update this again on Friday. They actually changed the reports, so you can only get the age groupings on once a week now. They used to publish it daily, but you can see the 30 age group really decreased significantly last week. And again, despite the positive cluster, if this cluster from the construction and DOC was going to affect the community more, we just wouldn't have seen us returning to these pre-cluster levels. There would have been some sort of tail off and maybe another spike if that was going to significantly affect us. And the hospitalization numbers, thankfully, continue to go down. This is my calculation on total prevalence. It looks like we're about getting close to that 30% mark in terms of the total number of people that have been infected. And again, if you're going to ask me why we're improving, why is our CAR score going down? Why, even though we haven't really changed much of anything about what we're doing, and I think it's because there's less dry tinder. There are less susceptible hosts that can harbor this virus and pass it to other people. Because we've seen a decrease in the number of cases, I also think that we're gonna be able to avoid this this regression where we're surpassing 150 deaths by the end of the year. In fact, the red dark line here is our actual deaths, and this was what is predicted based on the number of cases that we've had. So we're actually diverging from that, which is really great to see. I think there's a few reasons for that. I think one of the biggest reasons is that, this blue estimate is based on how many extra cases we think are in the community based on our test positivity. And I think that's skewed a little bit with the cluster that we had with the construction cluster, because I think we're actually identifying more of the actual cases out there. So a little bit complicated way of saying, I think there's a reason why we're seeing a divergence. I think it's great. And if our cases continue to go down, which is I think what's going to happen if we keep doing what we're doing, Thanksgiving is the big question mark here, how that's going to affect things. But if the cases continue to decrease, the actual line should taper off even more. What is that going to mean for us? It'd be great if we're in the 120 to 130. I hate to talk about this as numbers like that, but it is what it is, and anything better than this line is great for us. I tried to update the excess deaths, and now what we're looking at is based on the number of deaths, because we've had a lot of deaths in September and October. The excess deaths in Guam is now, a reasonable estimate is that our total deaths in Guam is going to be well over 1,100 deaths, and that is a deficit of 150 plus 69. And I put 150 because if we have 150 COVID deaths, that's still you're still left with 69 deaths that are sort of unaccounted for over what we would see in a normal year without COVID. So this again underscores the fact that there are probably COVID deaths out there that we don't know of. We probably are undercounting the COVID deaths, or as we mentioned before, it could be a case where the fact that COVID is here is allowing other deaths to happen in sort of these secondary chains of events that allow those to happen. So this is definitely not a hoax. And last slide, just to show the mobility data continues to be really stable. We're still, at least in the number of people out there on the roads, we've been sitting down at this low level. So, we have a really unique opportunity here to keep things going in this direction. Thanksgiving is going to be a crucial test for us. I think, we'll have to wait 2 to 3 weeks after the Thanksgiving holiday to see what kind of effect it's going to have. I saw some data about Canada. Their Thanksgiving's a few weeks before ours, and unfortunately, you can see a bit of a surge in Canada after their Thanksgiving. So the U.S. is going to be just a disaster over the next month or two. But in Guam, I think we've sort of preceded their calamity out there, and I think we're definitely moving in the right direction. And I don't know if you guys saw, but there was a third vaccine that was announced with a little bit less. There was 70% efficacy. This is an adenovirus vaccine that brings the proteins into the body that lets you mount that immune response. So the best thing about this new vaccine is that it is much cheaper and it's easier to store. You can store it at refrigerator temperatures. So there's good positive news, and hopefully those FDA approvals come out soon and we can start to vaccinate people in Guam.
All right, thanks.
Well, Doc,
Dr.
thanks.
Lombard.
Definitely provide a lot of insight into not just the CAR score, but into all the other data that you crunch. I don't know how you find the time for it, but we definitely appreciate it. And That's Dr. Peter
Well,
Lombard.
But you know,
my
Doc,
pleasure.
so
Thanks, guys.
just as easily and as quick as this car score can drop, it can go back up.
Oh, absolutely.
Okay.
Yeah. And that goes for any metric you want to look at, for sure. You know, as soon as, if we lose control of containment, it's going to shoot right back up again.
Yeah.
And it's going to shoot back up in the same chunks as it's come down too. So, you know, it drops by 30 points and you might see it increase by 30 points with a couple of bad days.
Yeah. So again, just everybody just needs to continue doing what they're doing in terms of all of the, what are we, 3 W's or 5 W's now?
I think we need more W's.
Yep.
All right. Thanks, Doc, and stay safe. Happy Thanksgiving.
Happy Thanksgiving. You guys be safe. And thanks again for having me on.
Always a pleasure. Dr. Peter Lombard, be safe, okay? Wash your hands, all that good stuff. There you go. It's 802 or KUAM FM in Agotni, Guam. To our viewers on KUAM